So I'll start off by introducing myself. So I'm Patrick Maxwell, and I have this extraordinary title, Regius Professor of Physic. So no one knows what I do, but basically I'm head of the clinical school here at Cambridge. It's a delight, obviously, to be firing difficult questions at my panel today. Rather than introducing them, I am going to ask them briefly to introduce themselves. I haven't warned them. So I want them to say one sentence, not 10 minutes, and I'd also like them to tell you how long they think they've been in Cambridge. So I can tell you I've been in Cambridge for 5.5 years, and it's gone like 5.5 minutes. We'll start over here, John. So introduce yourself.
So John Freeman, I work for RAND Europe, which is a public policy research institute, and my team specialises in innovation and health services. I've been in Cambridge on and off since I was 5. So I grew up in the area. I didn't study at the university, but I was very heavily influenced by the LMB, seeing Christmas lectures by Max Perutz, and that set me off on a career of science, and that's since led to science policy.
Next will be Richard.
Okay, thank you. Richard Gilbertson. I've been in Cambridge 2.5 years, chair the Department of Oncology and direct the Cancer Centre in Cambridge, and I'm a paediatric brain tumour doctor by training.
And then we'll go to Andy. You've heard about Andy already.
25 years.
Victoria.
I'm GlaxoSmithKline, based at our R&D hub down in Stevenage, and I look after the Cambridge GSK Strategic Partnership, and I have been in Cambridge for 5 years.
So about the same time as
About
you.
the same time as you, yeah.
Antonio?
Hi, thank you very much. I'm Antonio Criminisi. I work at Microsoft Research in Cambridge near the station. My specialty is machine learning, and in particular the application of machine learning technology to the analysis of radiological images. Hopefully, producing something really good and of value for the NHS. I've been in Cambridge on and off for about 20 years.
And Catherine?
I'm Catherine Chapman, and I'm setting up the Milner Therapeutics Institute at the University of Cambridge, which has been set up for a donation from Jonathan Milner, who you've already seen on a slide earlier, and also the University of Cambridge. And our mission is to turn groundbreaking science into new therapies. And I've been here less than 2 years.
Excellent. So a good spread of expertise, I hope you'll agree. And we're going to, we have some questions that the panel have seen. They think they're rather difficult. So when we run out of steam, on them, there'll be an opportunity in chunks for you to ask questions. So do think of the question you'd like to ask. And the sort of broad first area, I think, the panel asked to think about is why does Cambridge work and how can we keep it working? I think it's called sustainability. So I think what we'll do is the first panelist to sort of stick their oar in will have an easy time because they'll be able to say the first thing that comes into their head, and no panelist is allowed to say, I was going to say that. They have to think of something. So we've touched on this a bit, so I don't think we'll spend too much time on it, but a first broad question is, what do you think is a special ingredient that does make this a special place to be? And I'm looking for a hand. John?
It goes back, I think, to the nature of the university, which has always fostered interdisciplinary approaches to the development of knowledge. And, starting with the LMB is a good way to explore that. It's looking at life sciences, molecular biology, but its discipline started in physics. And the college structure and culture of Cambridge has enabled that interchange of knowledge. The challenge is going to be, as Cambridge continues to grow and the density of knowledge within Cambridge grows across disciplines, how does it keep fostering that ability to interchange knowledge without relying just on the college structures?
I mean, I'm delighted to hear you attribute it to the university, because of course that's where I work. But I mean, it's interesting that actually the LMB has really flourished outside the university. And when Hugh and I discussed this You know, I think it's better off outside the university. I think it gives it a bit more oxygen. You're very wanted, Hugh. Okay, Richard?
So I would disagree with that partly, just because this is supposed to be a fun panel. And the reason for that is not that it's not true, but many centres claim that. So I would actually say the top thing that Cambridge does, and it's already come out of some of the initial talks, is the pursuit of excellence. And it will not compromise on excellence. I think it was Hugh that was saying, I think it may have been Hugh that said that, because I think one of the reasons why it's so collaborative is that you have a lot of people who are confident because they're extremely good at what they do. And my experience is the most paranoid people in science are those who don't collaborate, are those who are not quite sure of their own position in the world and their own pursuit of the science they do. And so I think the pursuit of excellence really is what marks Cambridge out from other places that also claim to be collaborative.
Yeah.
Catherine,
Victoria?
Sorry, I just think that the pervading culture in Cambridge is about supporting people to be as successful as they can be, and to support collaboration. I mean, I think fora like CAMNTF enables people from right across Cambridge to get together. And I also think there's the leadership culture in allowing the academics really to pursue interests outside of their core academic research. So, you know, I don't think they're given particular limitations on consulting for industry, for exploring their own kind of spin-offs or companies. And I think in other places, academics are limited within their role specs as to how much time they're allowed to spend outside of their core research and teaching.
No, I think that's good. Yeah, Catherine?
I wanted to follow on from what Andy said, really, that actually it's diversity of excellence and attraction. So if you look at what Cambridge has, it's got this triangle of excellence: clinical excellence, academic excellence, and business excellence. And it's those three things coming together that really makes it unique.
So I just wanted to add that I think we have covered the collaborative aspect, in depth. Collaboration is a key part, but also what we haven't said, and in my opinion is really important, that the fact that such bright people come out of the university means that big corporations, I'm going to be biased, like Microsoft, AstraZeneca, and Amazon nowadays, and even Apple and many others, which, in theory, many of them have got nothing to do with what we are discussing today, actually choose to come to Cambridge because they know they can hire really solid, reliable, brainy people, and that, creates a virtuous cycle that then feeds back into everything everybody here does.
Yeah. Okay. And the next question is, what one thing, I mean, if you were, I don't know, the mayor or the Prime Minister, or you had some ability to control the mad political world we live in, what one thing would you do to make it better? And I think we could start with Andy here, because you spent all your time thinking about this.
I think it's quite handy we've got the Brexit Select Committee tomorrow, because these are the sort of questions we're going to answer for them. I think the biggest, I'm not sure if it's sustainability or a threat or a challenge. I think the biggest challenge we have is basic R&D funding, actually. So if you look at the Life Science Industrial Strategy, I think it identified that we spend about 1.6% of our GDP on R&D in the UK. OECD average, 2.4%. And the government made a commitment to get there in 10 years. But our current funding is 50% less than Germany, and half of that of the US. And what we've talked about a lot is, there's more to science and more to innovation than money. But at the end of the day, once we've left Europe, we may still be able to participate in European funding and all sorts of collaborations. But if our R&D funding is half that of the US, ultimately that's what will get us, I think. And you could argue where the R&D funding will go, which is another discussion on strategy. But I think it will ultimately be the problem we'll face.
So more money. Who has their next magic wand. Catherine?
Well, I've got a sort of more specific practical intervention that I think I would make, which would be about making the processes for interaction and collaboration much more smooth. So my investment would be around the mechanisms and making the interaction. So the first interaction you have with industry, a good one, a smooth one, a quick one, an efficient one, so that these people, so that scientists come back and there's a serial collaboration with industry. So mine would be around making that process smooth and efficient.
I think mine would be around more practical aspects of just affordable housing, really, to support young people coming into Cambridge. It's just getting rather ridiculous, and we're not going to get the new upcoming scientists of the future coming here if they can't bring their families and have a house.
John?
So I certainly agree with the infrastructural aspects.
No, you're not allowed to agree with someone.
Okay, but what I'll say then...
wasting time.
Okay, so I will develop the idea that increasing funding is a good idea, but the challenge for government is where exactly to put it. And I think probably one of the advantages that the life sciences sector in the UK enjoys is it has what's called great stickiness. The new ideas have the abilities to get embedded in industry and taken through to successful innovation that makes it to market. But that needs to keep on developing, particularly as life sciences converges more significantly with other sectors. The convergence of technologies means there's going to need to be more investment into translation processes for how these different technologies have converged, and that needs to be explored more carefully and may not be limited to the Cambridge area.
I would say better, stronger mechanisms for sharing data. You know, we are collaborating a lot, and yet it's very, very difficult to share data and make the most of data. I think most of us would agree that machine learning, sometimes erroneously called AI, has got the power to unlock a lot of information which is buried within this data, yet it is incredibly difficult, for good reasons in some cases, to really get access to the data. So having really good, clear mechanisms which are compliant, you know, they build on top of really good, strong data governance, but also allow us to, for all of us to build innovation on top of that will be key.
So since this is around health sciences, and if we had an unlimited resource of funds, I'd focus on the interface between the NHS and academia. So having spent most of my career in the States, the NHS is a fantastic organisation, delivers amazing healthcare, but the stresses on it to keep up with an ageing population, deliver that healthcare, and also provide the conduit, the main conduit for research in the healthcare industry is very difficult for them to do. There's a lot of willingness, but more investment on that translational interface would help.
Okay, and then another interesting question is, you know, obviously there's a lot going on. Could we coordinate things better, and are there things that are duplicated? Who would like to go first? Victoria.
I'd like to go first. I think you've made great strides in coordinating things. I think there is still some duplication. I think it's maybe a bit controversial to say, but I think most academics like to have their own centre or institute or little area that they own and have created, and I think we need to kind of push against that a little bit. I think within the university, having the new having CATS will hopefully address that a little bit. And I think the way the university operates with its cross-cutting strategic research initiatives and networks works very well. But I think there is duplication. I think there could be a lot more crosstalk, a lot more interdisciplinary working. I'm interested to see as well, as the campus grows and as West Cambridge grows, and that physical and life sciences is kind of physically separate, how they're going to collaborate more, and those are going to be brought together, because you know, the sort of digital and data analytical space, that's cross-cutting right across, and if the expertise are out there in West Cambridge, how's that going to be? How's that going to work?
That's a good question. I won't answer it, but I'll go on to another. But I think it's a very good point.
It's funny, as I was walking in this evening, someone said the biggest thing we could do is have more events like this, where we bring everybody together. So that's one thing. I guess I'm not going to agree with Victoria, because I'm not allowed to agree, but I think the compromise we have in Cambridge is what's bottom up and what's top down. There's been a talk quite recently about, certainly in the life sciences sector, as where's Cambridge's John Bell, who is the voice for everything in Cambridge. And yet one of the successes of Cambridge is a lot of it has come from the ground up, and a lot of our collaborations currently with the university are ground up. And actually we've just started talking about turning that round, and what sort of strategic umbrella could we put over that to ensure that we do get cross-disciplinary and a more focused way. And it's a difficult balance to draw.
Yep.
It's very interesting to hear, so I must say, it's very interesting to hear Andy speak today, because I think people generally tend to think that, the two main UK headquarters farmers are, at each other's throats. But we work very closely together, and I felt like I could have been standing up there and doing that talk and just put a different colour scheme on the slides. Orange.
We're not the same Tokyo, sorry.
No, that's quite good. But I mean, everything that you were saying is exactly what we say. So I think, that it's a great opportunity for us to be. I know we're not in Cambridge, but very closely aligned with Cambridge. I think it will drive AZ and GSK closer together as well.
But hopefully not merging.
No.
I mean, I think, companies get indigestion when they do these things, is my impression. So let's go for Antonio next. Yeah, sorry, do remember this is being recorded. I always forget that, so I'm likely to say very unwise things. Antonio.
I'd like to be very slightly controversial and say that there is value in duplication, right? It doesn't mean the fact that there are two teams working on the same or very closely related problems doesn't mean they will come up with the same solution. And so having that level of healthy duplication, not identical duplication, might be actually very healthy. It would help if on top of that you also talk to one another, we talk to one another, we have some level of coordination as well. But some level of healthy duplication might be useful.
So I don't think there's a lack of awareness that there's some duplication and there could be better coordination. But I think that what's important is having the knowledge of what's going on, and also clear signposting to what's going on, so people know what's going on. And I think, as Victoria mentioned, CATS, I think in the life science area, this is something that is really going to help in terms of signposting what's going on at the university to try and avoid duplication and coordinate better.
Yeah, so anything, rather than coming to me, go to Catherine. Richard.
So I don't know if it's what Victoria meant, but I'd sort of disagree with one of the points, which was pushing back on the notion of having institutes. Because I think the way that we do science and the way we socialise, and we heard the fantastic example of the LMB, they're wonderful entities where people actually work on a day-to-day basis. The problem is we simply don't invest enough time, energy, and take seriously enough understanding who each other is. So we have events like this and we tick a box and we think we've done that. But actually what really matters is that you bother, and it's the leadership that needs to do this, is understand what's happening in the LMB, what's happening in the C, what's happening at Addenbrooke's, what's happening throughout the campus. And not just understand it, but take very seriously the metrics required and how we can actually interface appropriately on an irregular basis. And very little time is spent on that in most institutions. And that's really what you need to do seriously, I think, to ensure that there is appropriate duplication, but also real collaboration.
Yeah, so the permeability and connectivity, I think we'd all agree, is pretty good. But I think, needs active work, thought, and we can all contribute to that. And events like this are very helpful, I think. John?
So I think the idea of how much control and coordination you have is one worldview and very tempting to certain people, and then the complete academic freedom, sow 1,000 seeds, see how many flowers grow, is another worldview and very tempting. And it's probably best in many ways to accept a certain degree of dynamic tension between those. Particularly where government is involved, there is a natural need to have some degree of accountability and coordination and planning, but not to the extent that it squeezes out the new discoveries and the innovation. But that's actually, I think, one of the key parts of the collaboration between government, between industry, between academia and charities. It can help direct a certain degree of what an academic I work with at Oxford calls requisite fuzziness. You know, the minimum requisite fuzziness you need to actually allow ideas to flourish. And if it's too rigidly structured, that just can't happen. So you need to accept the dynamic tension and actually work with that and encourage it.
Yeah, I think that's a good point. I mean, just to clarify what I think was being said about researchers and institutes, I think we have to recognise that amongst academics, one of the principles is sort of mutual repulsion if you're not careful, and they all do want their own little centre, you know, and I'm the centre for, and in a previous university I worked in, I think there were 4 centres for understanding heart disease, and the main thing that defined them being different is they didn't want to talk to each other. And that's not good. I think a big institute is actually quite a good way of bringing people together, you know, to collaborate around larger ideas and to impose some organisation and allow the fuzziness. So, do we have any questions from the floor in this sort of broad area? What's good about it and what might we do to change it? At the front. If you could say who you are. I know who you are.
So I'm Roland Sinker, I'm the Chief Exec at Addenbrooks. Antonio, you and I spent an hour and a half together this afternoon with Addenbrooks hearing what Microsoft needs from the National Health Service. Could I ask the panellists what they need from the NHS to be able to thrive?
Brilliant. So, Andy.
Oh, goodness.
Try to make it one big thing rather than...
Oh, come on. I think this has to be the opportunity for the NHS. I think we need to move from a period of cost saving to value generation. Quite how we do that, I'm not sure. It's a tough world out there. I think we need to treat NHS as a partner, so you benefit from some of these things. Quick wish list, if you like. More work on clinical trials. Can we take competitive advantage in the way we do clinical trials in the UK? How can we align all the data that's available within the Eastern region to make more informed decisions around data and digital technologies? We know that that's an area which the East of England is strong in. You've got genome cancers just down the road. So if I could stop at just 2, I would say digital data, clinical trials. Adoption of innovation, third one.
Very clear. Antonio.
Well, again, you know, as Roland said, we already spent a lot of time, you know, today talking
you don't
with
need
two
to
of
tell
us,
us that.
but you don't know that. Honestly, the biggest help you can give us is to teach us. You know, what are the biggest problems? What are the biggest problems for you that you would like a technology company like Microsoft to help you solve? And that's the biggest thing. You know, after that, like I said earlier, if we can figure out a mechanism which is safe, secure, compliant, and consented to exchange data for both organizations to benefit from the innovation that comes on top of it, that would be fantastic.
Catherine.
Yeah, for us it really would be about patient samples and access to data as well. So we're setting up a computational biology group at the minute, so I'd just like to reiterate the point of having data to be able to do that. Machine learning, artificial intelligence is absolutely critical.
That's reiteration,
Yeah.
but the samples.
Okay, the samples,
yeah. Richard, what do you want from the NHS?
Fit for purpose infrastructure and nurses. Nurses are the single most limiting factor at the moment for clinical trials and care.
John?
I think we need the NHS to continue to recognise the importance of research, not just clinical, but also the what works research, the health improvement aspects of research, so that they continue to ensure that that is the bit that doesn't get cut out when the times are tough. It's actually the stuff that needs to be kept to enable them to find ways of making things better for the future.
Victorian.
It's horrible being laughed, isn't it?
Sorry.
Shall I write some more down?
Yeah, but Andy literally did say the things I was going to say. But I think continuing dialogue between the NHS, all the life sciences, all the partners in the life sciences industry. I mean, us as drug developers, we need to know what everybody needs. before we can develop it. So I think the continuing dialogue and knowing exactly what the NHS needs from us, you've got the expertise, you've got the physicians who are seeing the patients who know exactly what we need.
Very good.
Yes.
Jagtar Singh Nijjar, I'm one of the NIHR clinical lecturers in rheumatology. I'm glad that somebody brought up samples because it gives us an idea of how many patients we have in our area, and also clinical trials, because in my former institute, I was at the University of Glasgow, we were leading on investigator-initiated trials, and I'm not sure whether that happened with Humira here. I've had the pleasure of treating people with Humira and seeing the impact it has, but how do we move forward in actually leading in those later stage translational aspects and actually, I don't know, taking charge of investigator-initiated trials and perhaps using the NIHR to the best of its ability?
So, late phase trials, and should we aim to have a leadership position there? What would be required? And I think probably the key people here are Andy and Victoria.
Are you, so you're not talking late, you're talking proof of concept patient trials?
Yeah, so I think that's an important point, isn't it? I mean,
Yeah.
Your view would probably be that late phase clinical trials, you'd be unlikely to be doing them here in the UK as a major.
Exactly. I mean, that's the point. I think it'd be great to have the capacity to do phase 3 trials in the UK. In Cambridge, I mean, you'll know that we have our clinical trials unit, MHRA accredited in the hospital, the GSK clinical trials unit, that we can do phase 1, phase 2A studies, but it would be great to be able to do those proof of concept studies in sick patients on site, to be able to have that continuity of investigators working through the early trials into the later stage trials. I mean, I'm just thinking about the support we're giving to Nick about trying to get the funding for the new Heart and Lung Research Institute, where there will be a clinical trials unit, and we see that as something that would be absolutely fantastic to have Papworth there and to have our unit, and then to be able to continue trials into phase 2, 100 yards away.
Yeah.
And the GSK unit is not recognised by everyone, I think, as an extraordinary asset on the site.
Yeah, I think that's an advantage to Cambridge as well. To have
Yeah,
that
I agree.
capacity, yeah.
Andy?
I would just say this fits into we want on here as opportunities. There is an opportunity there. I think, again, post-Brexit, I think we need to revisit our relationship with the NHS, how and where we do clinical trials. It was my cryptic comment about uptake of innovation. It's very difficult for us because a lot of our more innovative products aren't prescribed in the east of England. And ultimately that will, not now, but ultimately that will limit our ability to run earlier stage clinical trials if the docs aren't already using the most advanced therapies available. But I think there was a chance to change that, as I was saying, partnering with the NHS on those. I'm not saying that this should all happen just for free. I think we need to partner and find new ways of adopting new medicines and getting the clinical trials from UK-based companies done in the UK. I think there was an opportunity there.
So I think there was another question further back. Yes.
So otherwise I can't see you. How do we ensure
Remember
that...
to say who you are.
Sorry, yes, I'm Sarah Hayward and I'm the Chief Executive of MedCity. How do we make sure that Cambridge doesn't become a victim of its own success when we know that industrial strategy is very focused on rebalancing the economy? And how do we ensure that we continue to support the excellence and that political decisions don't drive investments into areas that perhaps aren't as strong?
Yeah, good question. So, John?
I think it's a really important question, and I think Cambridge will probably always enjoy a certain degree of privilege, particularly in public spending decisions, but there are probably ways in which Cambridge as a whole could consider how does it try and get ahead of this and make sure that it continues to enjoy the benefits whilst being part of developments in other regions. And so I would say partnership, networking and collaboration with other regions, and looking, when I talk about convergence of technologies and what does that mean for the future, where does the actual stickiness, the ability to turn those into fully developed innovations exist within the UK? So as things maybe move towards more of the advanced manufacturing, it may be that some of the Northern Powerhouse is the place to deliberately partner with that. And getting ahead of that game and making sure those partnerships and networks and collaborations are set up in good time means that you can actually support the industrial strategy's aims without losing out.
Yeah, so for those of you who don't know Sarah, who just asked the question, it runs this interesting organisation, MedCity, which is organising the Golden Triangle to work together on these kinds of issues, which is one of the networks that I think, I mean, if you think of the amazing concentration across the Golden Triangle, which has been referred to a bit and which we are proud to be a part of, across that area, I think we could coordinate more effectively, and there certainly is duplication and competition, some of it healthy and productive, but some of it perhaps less so. Andy?
So in true Ronnie style, I'm going to answer a question you haven't asked yet. Who are Cambridge's competitors and why? They're not in the UK, right?
Yeah.
So it's not Oxford and it's not London. And it's not the rest of the UK. So it is a great question. How do we organise the UK life sciences sector so that it is competitive globally? Because it's globally where our competitors are going to be. So I think the question is we do need that cross. One, we need the cross triangle cluster, because that is by far the biggest cluster. But we also already have a cluster in the northwest of England with food manufacturing and advanced manufacturing. So the short answer is identify, and a bit like the strategy slides I was showing you, that was a painful exercise deciding on which disease areas we should be in, because every disease area that was represented in the initial study thought they were the best in the world. It actually takes somebody from outside to tell you what the best you are at, funnily enough. So we need to work out from a UK perspective, where are we globally competitive and where do those global advantages sit? And you're right, Sarah, we then need to work out how do we then make sure that the benefits of those global centres get spread to the wider community. We do a lot of work in East Anglia now, looking at how we can energise and activate CC and over there as well. How do we enable people from the areas who aren't benefiting from the growth in the Cambridge area to benefit? So we've got to demonstrate and spend a lot of time proving that it's not just about the clusters, the places where we are globally excellent. But it's a work in progress, which we'll be continuing tomorrow.
Richard?
Yes, it's a great question. And in a sort of, it's not this identical area, but there's a debate next week in the House of Lords about brain tumours. And there's a huge push in the UK to develop a strategy which actually is off point. It's likely not to be good for the long term, but is sexy and new. And actually one of the combats we can have for that is by having a very clear strategy ourselves about what is right for patients. It's well thought out, it's been carefully iterated among partners globally. And if you don't have that, you're naked when it comes to those kind of discussions, because there's a lot of force behind. I think your point was with the life science industrial strategy, you can be pushed down routes that actually may not be well conceived and may not have the long-term impact for patients, but you need to be prepared with a strategy in hand to answer that.
Antonio?
Yeah, I think Cambridge is in a really good position because it already enjoys a lot of investment from the private sector. But we need to make sure that that continues in the future. And in my opinion, the best way to do so is to make sure that we really engage with deep relationship and conversation with the private sector to produce innovative technology which drives real impact. If we deliver real impact for patients, a little bit like Richard was saying, then that will ensure further investment and will make sure that Cambridge stays at the top.
Okay, so we're going to move on to challenges broadly, and Andy's itching to tell you about Brexit. He's told you a bit about it. In fact, several of us are talking with the Select Committee on Brexit tomorrow, I think. And my question for each of the panel members is, what would you say to them? And again, you're not allowed to repeat what someone else has already said. So, Catherine, what would you say to the Brexit visitors, with sort of, Cambridge in mind?
I think this is probably one of those questions where you don't want to be first, really, rather than last. That's a bit mean. So I think I would probably say, obviously, we need to do something about the uncertainty. We talked a lot about how Cambridge is really able to attract the best talent. And at the moment, for me, one of the biggest risks is that actually maintaining and attracting that talent, it's uncertain at the moment.
Yeah.
So my comment would be around that and trying to just reduce the uncertainty so we can keep attracting the talent.
Richard.
Yeah, so actually I would go more boring around regulation. And so around the whole mechanism, the whole vehicle that's been the European Union that we've been part of, is the infrastructure around regulating drugs, regulating clinical trials, and that's a complete mess and is actually a real threat to how we would manage clinical trials, how we would access drugs, how they'd be regulated. That's something that I think really attention needs to be paid to.
Yeah, I mean, from similar to that, but adding on, I mean, for us, obviously, it's about getting our medicines to patients, and our supply chain is scattered all over Europe. We need to be able to get our medicines through to the patients who need them without things being held up, and that's going to be our biggest concern, I think.
John?
I think I would take a threat and an opportunity. So RAND did some research last year on the mobility of researchers, a piece of work we did for the Royal Society. What influences the mobility of researchers? Obviously that has relevance for Brexit. And it's basically expected by most researchers that they have to do international tours to develop their career. So the threat is whatever Brexit does, it could really damage Cambridge and other places. I'd say the opportunity is building on the regulation piece. There is a real risk around the regulation piece, but let's turn Brexit on its head and say, hang on, if we are going to step away from some of these regulations or some of these protocols, what can we put in its place that is going to be even better and turns into something that the UK can export as an improved way of doing things? But that's a very big ask.
I think the other positive, adding on from that, and that I mentioned to you earlier, Patrick, is that, and I think even getting the life sciences strategy together, it's forced the life sciences community together, and I think coming out of the EU will force us to talk together. It'll be a collaboration enabler, I hope.
Andy?
I'd actually like to hear from the audience on what they'd like the question to be.
Yeah, so we'll do that in a second, I think.
I'd reiterate two things. One is that as things stand, patients in Europe won't have access to their cancer drugs when we leave the EU because of the regulatory concerns and getting batch control of our medicines. From a Cambridge perspective rather than a company perspective, it's about people. We are starting to see signs of struggling to recruit the top talent into Cambridge. And if you didn't get my message from my talk, that's what it's about. If we can't bring the top talent into Cambridge, then nothing else is going to matter from a Cambridge development perspective.
I just wanted to add a quick point about the regulation bit. In practice, not very much is going to change for the next 2 years or 3 or who knows even more, because it's just going through the Brexit process is so incredibly costly and time consuming. And the best thing that the government is going to do in the short term is to adopt the existing regulation. A clear example is GDPR, the General Data Protection Regulation, which many of us are aware of, is going to kick in May. By the way, most of us need to really know and be prepared for what's coming. That's not going to change. It's already been said that post-Brexit, we will maintain that. What's going to happen to regulatory affairs around drugs and software medical devices and so on, we don't really know. And so we go back to the point of uncertainty. I don't see much positives coming out of this, to be honest. It's, in my opinion, most of it is negatives.
Oh, I quite agree. I mean, I hope I'll wake up and find it's all a bad dream. Okay, so, we've got many people who are certainly better placed than me to tell the Select Committee compelling things that they should worry about or do in the context of Brexit. You've heard some things from the panel. What are your ideas? Yeah, so at the back there.
Hi, Sarian Bowers. I'm the policy lead at the Sanger Institute. I think what I'd really like to be hearing, to the message I'd like to hear being given to the Select Committee, is that science isn't a zero-sum game, that actually it isn't us versus Europe, it isn't about Britain getting a better deal than Europe, because actually in that situation everybody loses. Science is only one when we all work together. And so it's more of a comment, really, than a question, I think. But that's a message that I'd really like to hear coming out, that we are stronger together and that actually the deal has to be how we can work together, not how we can get a better deal than Europe.
Yep. Excellent point. And what other... Yeah.
Yeah, hi. Maxwell, I'm Cambridge Independent. Yeah, I'd really like to see... we talked about collaboration, and that's fantastic. Business leaders, economists have sort of put together a sort of a sectoral sort of open letter to the government, which obviously is made public. So I'd quite like to sort of think in terms of, how Andy was saying, 300 jobs are at risk, AstraZeneca alone. How can we protect those people? Can we put out a collaborative statement, or can you put out a collaborative statement saying that, you would like to ensure that life sciences are ring-fenced?
Any other burning things for us to say?
Supporting research in general practice in the region. I think I'd like to know how much of the 350 million a week is going to support innovation.
Yes.
And I really think that needs to come through. And for the NHS.
Yeah, good point. Okay. So, another question for the panel. Are there global issues that Cambridge is failing to grasp? So this is quite a tough one. I'm going to give them a second or two to think of something.
I went a bit left field, I think.
So Victoria's prepared in advance and has actually done some thinking. So Victoria.
As I say, I went a bit left field and went and started thinking about some comments in the media at the end of last year about how Oxbridge is still failing to get students from the poorest parts of the UK in particular. And I think just about the need to bring in diversity into life sciences, the need to obviously support women to be more senior in life sciences positions. I think that is a global issue.
Yeah, and I think you're right. We have not grasped that fully. So there's, we are at the point of discussing it and owning up to it. But I think I heard in the last few days, if you live in some wards in the north of Cambridge, you are less likely than anywhere else in the UK to go to Oxford or Cambridge. That may be because you know that it's a terrible place to go to.
And in the,
Andy?
In those same areas, you've got a 10 year shorter life expectancy as well, which is appalling. So on a similar theme, I'd say Cambridge hasn't got to grips with populism. I think the Brexit vote, certainly in my local circle, was the biggest shock ever, because I didn't know anybody who voted to leave. And I think if the people out in, let's not characterise them, if people from other areas were sitting in this room today, they're saying, goodness me, that looks very Cambridge. What relevance does that have to me and my community? Perhaps it comes back to how do we ensure that the wealth and benefits of Cambridge spread even within Cambridge, never mind to other parts of the country. So I think there is something about populism that it's very difficult to grasp in our world, which is hugely diverse, but also very well rewarded.
Richard?
The answer is yes. I mean, of course there are, and there's a lot of them. I think, having spent most of my career in the US, I think Cambridge, like a lot of British culture, underestimates its impact it can have on the world. And I think it's seen from the US as a sort of fantastic, somewhat archaic institution. It's not true in all areas of engineering, energy, etc. It's very strong in, but actually our impact on medicine and the influence we can have in developing countries, etc., could be quite significant, and certainly more than we give ourselves credit for.
Yeah, so I think this influence on health in less developed countries is quite a major area that at the moment, you know, we do some stuff there. We sort of probably don't articulate it as clearly as we could, and I don't think we, you know, explain how we think about it or have joined it up. Catherine?
So we had these questions in advance and I've still struggled to think of an answer. But I think in purely selfish terms, and maybe not quite as global as the points we've had already, is skills shortage. So I know in terms of bioinformatics, big data, artificial intelligence, machine learning, I think Cambridge has to own that there's a skills shortage there. And if we do want to be at the forefront nationally and locally of that, we need to be able to train bioinformaticians and mathematicians in that area.
Unfortunately, my answer is going to be very similar to Professor Gilbertson.
No, you're not. You have to think of another one.
I can make it a little bit different.
Or make it different quickly.
If you know, quickly. To me, it's interesting to hear that actually we are doing something in less fortunate countries in terms of spreading what we know about healthcare in those countries, because that really it seems to be a secret. When instead, you hear of Bill Gates Foundation, to name one, making big inroads in various types of vaccines and malaria and sanitation. Cambridge doesn't quite have that PR effect on the world. So that's the one thing I would say could be done better.
Better sort of articulation of what we do.
Yes. And again, this is my own ignorance. I don't know exactly how much we do there, right? And this is my ignorance. Is it at the same level of what charities in America do, or is it even better? It would be nice to know.
John?
I'd go a bit further than just the transfer of healthcare knowledge, and I'd say it's more about the exporting of skills far beyond our borders for several reasons. I think it has something to do with migration. I can't identify the causal link or prove it, but I think it's quite important as part of social global equity that we are transferring our knowledge further afield and helping build capacity and capability in nations all over the world. And I would say, I do see some institutions actually doing this very well.
Yeah.
And I'll take my own professional body, the Royal Society of Chemistry. It has excellent networks across the world to build chemistry skills everywhere, and I think that needs to get bigger and be expanded further, and Cambridge actually has a unique opportunity to push that further and deeper.
Yeah, and I think, although we haven't articulated, I think those of us in the room who do think about this, building capability is much more how we approach it than exporting knowledge. Okay, I think that was a very interesting set of answers. I don't think we'll ask who Cambridge's competitors are and why. I think we've answered that. So I think around the world, one of the questions we might think about is, where do you see partnering, broad collaborative arrangements working really well, and what can we learn from that? So, Antonio, you could start.
I'm going to blow my own trumpet a little bit. Apologies for that, but we already mentioned collaboration between Microsoft and AstraZeneca, and there is collaboration also going on between us and Addenbrooke's in particular. And very brief history, when we first started to work together nearly 10 years ago now, things take time. Obviously, there is a little bit of suspicion. Big American corporation is coming here, going to steal all our data, and they're going to disappear. But I think we can say that wasn't the case. We haven't disappeared. We're still very heavily invested. If anything, we want to do more. because we believe we are generating value, in particular for the radiotherapy department in Addenbrooke's, now trying to work more and more with radiology and scaling up to surgery and hopefully pharmaceuticals again. That is working well, but it takes time, especially to build the trust and to make clear that we are going to both benefit from one another. And that takes commitment, investment, but mostly time commitment from individuals.
So real patience. And as you look around the world at other Microsoft sites, what are other good beacons, where you have partnering that works, and what's special about those environments? What can we learn?
It will take a very, very long time to talk about all those partnerships.
No, you just pick one.
Partners are the heart of what Microsoft does. I will pick just one, which is a very recent announcement where Microsoft is partnering with Adaptive Technology, which is a medium-sized company based in America, which is all about immunotherapy. And it's very clear where the common ground is putting together what they know about their business in biologics and what we know about the machine learning capabilities for analyzing vast amount of data and extracting useful insights from that. I think there is a very recent example, but it's already starting to work very well.
Mm. And Catherine, I mean, in your building the Milner Institute, you must have looked around the world at different partnering models. What's impressed you and why?
Yeah, so I think the one-to-one models work quite well. So obviously already, so you've got the GSK Alliances, the AZ Strategic Partnership. I think where it's more difficult is where you're trying to bring a number of companies together working pre-competitively in the same space. And I think that's important because otherwise Cambridge is limited space, and actually, you could end up having 2 or 3 companies working with Cambridge, and then that closes Cambridge off for business, if you like. So I think it's really important to get the pre-competitive models up and running. And there I would look at the Innovative Medicines Initiative, the Dementia Consortium, the Dundee Drug Discovery Institute.
So
there's some really good examples around that you can model that on.
So I think the Dundee Drug Discovery setup is really impressive. And I think there are aspects that we could certainly learn from them.
Yeah.
Richard, I mean, you've spent quite a lot of your life in the US.
Yeah.
It's obviously better than here.
Oh,
why? And which bits particularly?
It's obviously not better than here because I moved back. I think it's these are obvious points, but it's very context dependent. It totally depends on what the collaboration is that you're talking about, and it will be different, so sites will be different.
Yeah.
But the ones that work, in my experience, are ones where it's been absolutely symbiotic. So it's not a one-sided or even weighted towards a one-sided partners, because it will ultimately fail. And then going into the relationship, it's critically important that both parties understand why they're going into it. And that's what gives longevity to a good partnership. And that might be in China, it might be in Singapore, it could be in the US. But one-sided relationships rarely work.
John?
So, one of the things that we do at RAND is we conduct evaluations of innovation interventions of different kinds. We're quite often asked to do the independent assessment of what does the evidence show you, is it working or not, and what about it is working. One of the ones we did in recent years that I think was showing really good examples of collaboration was an open innovation model that was set up between Oxford and Canada, the Structural Genomics Consortium, and we were able to very clearly evidence that there were strong benefits from the tripartite funding model of industry, government and charities, but this process of setting up what the goals were, but having very relaxed approach, or a more relaxed approach to intellectual property until someone decided to exploit it in some form. And the evidence we were able to identify was that did help loosen up the transition of knowledge into solutions in various ways. So I think it's quite a nice example. I hardly dare mention Oxford here, of course. But
No, I think you should. And actually, I think the SGC is a fantastic thing. And it's not the kind of thing that we should copy, because it's done and it works really well. And we obviously have people who are involved in it one way or another, or who use it. But I think a question for us all should be, what would we do that was on a model a bit like the Dundee thing or the SGC, how could we do something like that? And actually the cryo-electron microscopy, which you heard about, quite a bit of thought has gone into making that technology easily available in this city and this country, actually. And you might want to say something about that. Need the microphone.
Yes.
Well, because I think we could have ended up in a rather invidious position where people in Germany, China, the US are buying these microscopes as fast as they can. Actually, the company can only build a certain number. So it was possible that in the country where much of the technology was developed, people couldn't easily access it.
Yes, I mean, is this on?
It is, yeah.
I think we've always had the attitude with these technologies that they are so far-reaching we can't possibly hog them for ourselves. And in fact, there's absolutely no point, because if you don't make your software available to the world, someone else will write a better package, and then you've lost out. So it's been very open. I think the best example was this arrangement with the university and with the company FEI that makes the microscopes to set up a system, a facility in nanoscience to which companies could buy into and get access. And we put one person equivalent there full time to help them get things running. We have collaborations with some of these companies so we can actually transfer the techniques, teach their postdocs how to do it. And it's in our interest, actually, that more people do this. There's a brief flurry for the first 2 or 3 years, we were churning this stuff out, looking nervously at the Chinese, who were coming up very fast behind us. But we did early on, when we sort of started asking for more and more equipment ourselves, I said, look, we cannot justify this unless we do something nationally. This is a great opportunity for the country. A bid was put together with the Wellcome Trust, went into the government to fund these sort of all over the country. The government was a little bit slow to pick up on that, to be honest. It was a bit disappointing, but it is now happening, and I think it's getting much better.
So I think that kind of thing, we should aim to do more things like that. So this is a very good arrangement set up at West Cambridge with input from the LMB, space from the university, money and expertise from industry, and maybe we should make people more aware of it as well.
Yes, and in the early days we did host visitors, and we taught people. People came from Leeds, for example, and they went off and bought a couple of these microscopes because they could justify on the basis of their results. You need to be able to dip your toe in the water with something as expensive and difficult as this and prove that it works before you can persuade even your bosses at AstraZeneca that it's worth buying a couple of them.
So I think we should aim to do more things like that, because they also build capabilities that attract in bright people and sort of feed this cycle of discovering useful stuff and reinforcing that this is a good place to invest. So, on this international aspect, any points from the audience? Yes, Ron.
I wonder if the panel would like to reflect on China. China has huge aspirations to develop its life sciences industry, and in two particular aspects. One is the sheer might of its resources. I mean, take BGI, they're churning stuff out, like nobody's business. But more importantly, from the point of view of regulation, they have this tendency to ignore national norms. So come 5 years down the line, when they've done gene editing on germ cells, which we don't allow, and they've actually wiped out certain inherited diseases, are we in the West going to regard them as pariahs, or are we going to congratulate them for doing something well? So how is Cambridge and indeed the Golden Triangle strategy going to be in terms of what is going to happen in China? Are they a threat? How are you going to change?
Yeah, great question. So we will start with Andy, who's been a bit quiet recently.
So it's difficult to answer on behalf of the Golden Triangle or about China. I think we see China as a huge opportunity, and I think it is disruptive. You're right. There's disruptive technology. We can hardly reject disruption. I think increasing sales, increasing drugs, increasing collaboration. Perhaps not unexpectedly, the Chinese expect something in return. They don't want us to send our perfect pharmaceutical products to their country without getting anything back from it. And so working in collaboration, and particularly in disease areas which are specific to the Far East market, makes a difference. Commitment to manufacture in the Far East is another commitment which you have to make. So I think we have to go forward as an opportunity whilst making sure we have the regulatory environment which ensures that we're protected from any excesses which may come along.
Victoria?
I'm afraid I am gonna have to say that I find it hard to add to that.
I mean, from my perspective, I think rapidly we're going to be learning from China, and I mean they are changing their regulatory framework, in real time, and it's, I think they are recognizing that the freedom from regulation, probably brings far more problems with it than having sensible regulations. So I think they're going to develop much better regulation really quickly. And one of the things I find fascinating is this is somewhere where digital healthcare is going to happen much faster, I think, than here. We live in a world where paper is deeply embedded in how we interact with doctors and healthcare professionals, and where the NHS is fiercely obstructive of data moving around for all sorts of quite good reasons, and some are rather bizarre other reasons. But in China, it is all on mobile phones, and that's how it's evolving as you watch. Antonio?
I just wanted to add that brings up a really important issue, which is all the ethics that goes around it, right? So these are very, very deep ethical issues that we need to confront, okay? So would I want to work in an environment which is very much deregulated, and therefore I can have access to all sorts of patient data and do whatever I want with that data? Yeah, that can help me make quick progress in the short to medium term, but eventually that sort of behavior is going to come and bite really hard, bite back. And so where do we want to operate, and how do we want to operate? But at the same time, maybe the regulatory environment that we're operating within right now is perhaps too restrictive, and we can learn something from China or other similar geographies. So at the end, you have to really dig deep in the bottom of your heart and say, how do I want to operate? And I tend to err towards being more ethical, and something that I can be really proud of.
Richard?
Yes, it's a fantastic question. And I spent a little bit of time there in relation to cancer. And Patrick's right, it's dramatic, and you're right, it's dramatically accelerated its progress. But that's brought its own problems. So the NHS is 70 years old, and it's evolved over that period of time. It's come across problems, and it's learned how to deal with them. If you look at the healthcare infrastructure in China, it's non-existent. It's terrible, actually, for most of the population. And so, whereas some of their institutes are fabulously equipped to do science, an opportunity for us is to help them develop their healthcare infrastructure and partner with them on that. And that gives us an avenue also to collaborate in translational work. Their numbers of patients are staggering. I mean, here we'll see maybe 100, 150 brain tumours a year. One hospital I visited, 900 a year. And that's a moderately sized hospital. So the opportunities to collaborate and make progress are great, but they need a huge amount of help with their educational and healthcare infrastructure.
Catherine? Okay, great. John?
I'll develop a theme that I've sort of been advocating a bit tonight anyway. I think there is an opportunity in working with China to help them think about developing that regulatory regime. The regulatory regimes that we have in the UK and Europe didn't emerge because someone felt it would just be a good idea. Generally speaking, they emerged because people identified harms, and there was a need for a public control of those. And I mean, several years ago, the European Commission Joint Research Committee, I think it was, published a great report called Late Lessons from Early Warnings, a series of case studies from environmental disasters, human health disasters, including, for example, asbestosis, and helped you to understand from a social science perspective why regulation comes about and how one should go about in a society detecting the things that might lead you to need a regulation in some form and what a proportionate approach might be. And we're starting to see these signs in China quite strongly. And it's common with anywhere where there seems to be a growing middle class, but food safety is becoming a much more significant issue in China. Anyone that's had a baby in the past 5 years will recall just how hard it was to get baby milk at a sensible price because of the scares of acrylamide in baby milk. That will drive a public demand for regulation in certain areas, and it will happen in other places. You know, there have been massive industrial accidents with explosions that have taken out vast sites. So I think actually in our interactions with China, we have the opportunity to help stimulate that debate and discussion and help them recognise how they get there faster in a way that enables them to succeed and us.
Terrific. Well, I think, Malcolm, we are probably out of time. Is that right?
I'm going to be very brief, so you can have a few more minutes if you want.
Well, what about the audience? Have you had enough? So what I'll do is... So what we'll do is we'll sit here, and if there are no questions for a couple of minutes, then we'll take... Oh, there's a question.
Yeah. Hello, my name is Vitalina, and I am immunogeneticist from University of Cambridge. And one last question, I think. And what are the global trends in biomedical and biomedicine or technologies, and which could be seen in Cambridge within these collaborations? And spectroscopy, digital healthcare, monoclonal antibodies, or something else? Thank you.
So just to clarify, I think you're asking, you know, what do we see as the biggest exciting new developments? Is that right? Coming from here, or that we should pick up on elsewhere? So new things that we think we're going to be telling the world about soon?
Yes, soon or now or
okay.
General.
Really exciting things going on here that are going to change the world that we haven't heard about yet. Antonio.
I can give just a very brief example. I was, at the end of November, I was in America, in Chicago, at the RSNA conference, Radiological Society of North America meeting, 55,000 people all going to one place. The single biggest theme was AI, artificial intelligence. Very scary stuff, okay? So in the press you read, oh, AI, will steal people's jobs, radiologists' jobs. Well, Stephen Hawking says that we are all doomed anyway, not just radiologists. But it's a big team. There is huge potential for benefiting society, but at the same time, it's a very, very scary thing. And so I was fortunate enough to be talking there and trying to really separate the hype from the truth and say, these are the benefits. These are just software tools, like many other software tools. And if we do it right, we can all benefit from it. It is one of the biggest themes in healthcare right now.
So sort of turning AI from hype into real benefits.
Absolutely.
Yeah. Richard?
I think it's a great question. I think for me, and it's across all diseases, not just cancer, is using physical sciences to detect diseases as early as possible. So much of the problems we run into with diseases is because we let pathologies go on and on for decades in some cases, and we deal with a train wreck in patients at the end of the day. As soon as we can intervene with diseases like cancer, heart disease, dementia potentially, if we have therapies for that, the better. And the heroes of that will be the physics, chemists, engineers who are developing detection devices for early detection of those conditions.
John?
We've seen a lot of advances in the research in quantum, particularly in physical systems. I continue to be absolutely perplexed by quantum biology, and I think it's an inherently difficult question to answer, but I would be really curious to see in 10, 20 years' time what we're doing with quantum biology.
Yeah, so quantum biology. I mean, I'm fascinated by these things like, quantum teleporting, where as far as I can understand it, you can communicate at speeds that might well go beyond the speed of light because of uncertainty being linked. That's wrong. Yeah, you see, it's very dangerous saying it. Yeah. Okay, so ignore what I said, it's wrong. And quantum computing, if I could understand it, I'd be excited by it. Okay, Andy?
So I'd refer you to my last slide, which was fairly cryptic, but it'll give you some ideas on the sort of things we're thinking about. To be fairly boring, I guess, new drug modalities. So moving away from small molecules, moving away from proteins to what comes next. So you'll see we have a lot of work going into genomics, but a lot of work going into things like gene editing as well. So it's what is the wave of technologies beyond. I came in at the very early stage of the antibodies, actually. It's taken 20 years to get antibodies accepted as a new drug compound. But I think gene editing and new ways of manipulating the genome are probably where things are going.
Victoria?
I think it's very interesting, the movement towards gathering real-world evidence in drug development. Yeah, I think,
and if we could really do that,
if we could really do
that.
The world, I mean, the moment we're doing clinical trials on, young male healthy volunteers, that's not representative of the world. I think the more that we can do that, the better data we will have and the more success we'll have in drug development.
Okay, well, at that point, I'm going to finish this bit, but I would like you to thank our panelists very much indeed.